Niall Dickson is Chief Executive of the NHS Confederation, which is the membership body for organisations that commission and provide NHS services. Morning to you.
Morning.
And we discover this from a newspaper, not from the government. Your feelings?
Well, in one sense, there's a sizable shipment, but only a few days' supply, and the government's busy sourcing gowns elsewhere. But it does show the absolute danger of making promises when you can't be sure you can keep them, especially in this area. We know that, the number of gowns or masks or aprons or the type or the quality of equipment is not always what it says in the box. And we have warned that setting targets that are not met or saying it's all going fine when in the front line it manifestly in places is not going fine undermines confidence, and it undermines confidence not just of our members, local leaders, but among frontline staff. So I think the message is it's better to under-promise and over-deliver than the other way around.
Has what is needed been delivered now?
It's certainly a lot better than it has been. First of all, I think it's fair to say that in hospitals now, the reports are generally, yes, we're all right. There's still an element of hand to mouth, which is we've got a day or 2 days supplies of X or Y, and we're relying on the next delivery. So there's still that element of it, which of course causes anxiety, but generally better. I think there are still problems in the community, and we do know that care homes, family doctors, community services, they have been sort of second order, I think, or certainly perceive that they are second order. And I think there are still some difficulties there, but generally I think it has improved. And, everybody in government is doing their best. They're working day in, day out, like everyone else, to beat the virus, and it's all a bit unprecedented. But I think it is just making sure that the rhetoric is matched by the reality on the ground.
But when we talk of an improvement, is at least part of that coming just because people have taken things into their own hands and managed to find their own kit where they can at a kind of almost an individual level?
There's a bit of that. Secondly, there's improvement in what is termed mutual aid, which is places that have got more are now sharing it with others because there's an absolute recognition that other parts of the system are not working so well. And to be fair, I think they have improved the supply chain. They're using what are called local resilience forum or fora, and these are basically the public services within an area, and they're organising at local level what people need in a way that I think sometimes at national level it's very difficult to understand. And that was one of the real challenges at the outset. They had a system which was basically aimed at hospitals with 200 customers, and suddenly they found they had more than 30,000 customers overnight, and the system couldn't cope.
It's really interesting you say that. Talk of centralisation and decentralisation, because in a sense that you hear that as well when it comes to testing and the decision that there was to stop community testing and tracking and tracing of cases, and some people saying actually there are plenty of virology labs that could have carried it on, but we do it all centrally through Public Health England. Is that one of the messages for you in all of this? When you look at places like Germany and their more decentralised health system, that's the direction to go in?
Yes, I think it's absolutely clear, and the government has now absolutely acknowledged that the next phase involves mass testing. I think there is a communication conundrum here. If you take testing, we withdrew contact tracing and the testing of the community, as it were, when the numbers started to go up. But there wasn't really an explanation that we needed to build up our testing and that we would be coming back to mass testing later on.
But also the numbers actually were quite small when we did it, weren't they? We hadn't had that many deaths, and there weren't that many known cases when we did it in mid-March.
No, absolutely. So we weren't ready in that sense to start doing community testing. But there wasn't also, I think, clarity about what we were planning to do, which is build up the testing so that when we did action the virus, we would have a system of contact tracing reintroduced to try and keep the virus down. And, there are two schools of thought about this. Keep things simple, don't confuse people with the next age and all the rest of it. And there may be merit in that. But I think if you get the timing right, it must be better to explain to people what is going to happen and how it's going to happen.
But also to decentralise.
Yes, indeed, and I think there are lessons there. Of course, there's an element of command and control, which you do need in these kind of emergencies. But, again, our members were told last week, rely on the national system. Well, you can imagine the reaction now, having heard about what's happened to the Turkish slice. People will certainly be saying, well, I'm not going to follow that. I really am still going to rely on where I get a local supplier and I know that it's actually worked.